Okay, so we're going to get started. Thank you for taking the time out of your busy, hectic days right now to join us for our third COVID webinar. And we are trying to make these as useful and relevant as possible. So we do encourage individuals
I'm with this.
to submit ideas for future topics using the chat feature of Zoom. Or you could always email the email address on the last slide for additional topics. Based on feedback that we received last week, I could already announce next week we're going to be focusing on helping individuals on the spectrum with the new regulation that all individuals, at least in New York, are required to be wearing a face mask when they go outside. So we will have a guest speaker, an occupational therapist, to talk about how to manage that from a sensory perspective. And myself and Dr. Jessica Zweifach will talk about behavioral strategies for both getting kids to wear a face mask and also helping them cope with the anxiety of seeing other people wear face masks. Especially for anybody who had significant medical issues and have maybe been in the hospital. They might be associating the face mask with illness and a hospital. So that's going to be next week's topic. We are going to be having it on next Thursday at noon. Also, feel free to chat if there's a better time, because again, we want this to be a great resource for families. As we all know, this is a challenging time for everybody, but especially for individuals on the spectrum as well as their caregivers. So today we are going to be talking about effective communication strategies at home with a focus on increasing compliance, because as we have been hearing from a lot of families that we work with, getting kids to do homework, getting kids to maybe practice some of their exercises for PT or OT are challenging, and families are often meeting significant resistance. So we're going to be talking about some strategies that you can be utilizing at home to try to increase compliance. So we're going to start with brief introductions, just for those that might be joining us for the first time today. We're going to talk about compliance and listening as a behavior, talk about antecedent strategies, consequence strategies, as well as tone of voice and kind of our own caregiver mental health when we're communicating. And then we'll leave a significant portion of time for Q&A. So again, thank you for joining us. My name is Michelle Gorenstein. I am a clinical psychologist, and I'm also the director of outreach for the Seaver Autism Center at Mount Sinai. I'm joined today with Dr. Jessica Zweifach. Jesse. Dr. Zweifach, I think, is having some technical difficulties and will be joining us. She is also a clinical psychologist at the center. She is also one of the clinical psychologists who has been doing these webinars with us. So we will begin. So in terms of thinking of compliance as a behavior, and when we think of behavior, we always think about that it's serving as some form of communication. And why should we make this a focus right now? Well, right now, we're caregivers, we're teachers, we're coaches, we're chefs, we're OTs, PTs, ABA therapists, and we're being asked to give a lot of instruction and give a lot of prompts to our children who are at home. So we want to think about listening as a behavior. And when we think about listening as a behavior, we can think about how to improve it. Because when we think about modifying a behavior, We think about what happens before the behavior and can we modify the antecedent, so what's taking place before we ask somebody to do something, as well as the consequences of the behavior. So when we think about when we're asking a child to listen, we want to think about what is happening before that occurs, as well as what is happening once we ask the child to listen. And I'm going to turn it over to Dr. Zweifach, who's going to talk a little bit more.
Yes, sorry, I'm having some technical difficulties, so hopefully I don't cut out again. Yes, like Dr. Gorenstein was saying, we think about listening as a behavior. So we're going to talk through today both ways that we can improve compliance and listening through thinking of consequences, things that come after. In general, most of us spend too much time focusing on consequences when we're thinking about how to reinforce behavior. There can be positive and negative consequences, and they're great to use, but a lot of the talk today will focus on things that we can change before, ways we can anticipate the behavior. So starting off with a couple of antecedents, one thing we want to think about is building on that positive relationship that we have with our children through daily special time. We're pulled in so many different directions all the time, especially during this difficult time where we're working, we're cooking, we're taking care of children, and we're their teachers as well. So we want to, consider consider that and make sure we have just about 5 minutes a day where we're hopefully really focused on letting the child lead through play or an activity and really just focusing on them. And you can make a big difference with truly just 5 minutes a day. It doesn't have to be an hour in addition to all the time you're spending with homework and other things. We want to think about the number of demands that we place every day on our kids, and we want to think about that during this special time, we try not to place any demands, just follow their lead and use as much positive language as possible. We also, at other times, not just special time, want to use validating language, where we're thinking about even when our children are acting in a way or behaving in a way that we don't necessarily approve of, we can try to focus on the emotion that they're feeling and validate it. It seems like you're feeling frustrated right now. It seems like you're feeling angry right now, and hopefully help them redirect to an appropriate way to express that. Another antecedent strategy is increasing predictability by using visuals and routines. So, we can use visuals for this wanting our to bedtime and things like that. Also, you know your kids best and your household best. So if any specific points in the day are a struggle, focusing on those is great for mealtime or bedtime or anything else where you want to break down the steps a bit more. And as we talked about, another way to increase compliance is for kids to really know what to expect by using 3 stories, a visual schedule explaining if you do your homework, then we get to go for a run outside. And token economies are something that takes some time to get set up, but they're another way where a visual might help to reinforce certain behaviors, specifically listening and compliance. Another big thing to think about is making sure that we're giving instructions in an effective way. So effective instructions are direct. For example, you would say, please bring your plate to the sink. That is a direct, clear instruction. You learn one thing, and we try to avoid asking questions, because if we ask questions, will you bring your plate to the sink? Your child has the opportunity to say no. So we try to avoid that kind of word. Also, we try to avoid let's when if we want our child to do it independently. Let's can be helpful if you're actually going to help clean the room, but trying to just be direct about what your child wants to do at what you want your child to do, and clear if you're not going to be helping with that task. We want to be specific. So please clean up the mess versus put the blocks in the box. Clean up the mess can feel very overwhelming to kids. The isn't totally clear. It feels like they have so much to do at once. So if you're specific, you're breaking down the next part of the instructions, giving learner a much better chance compliance then. We also want to be close to our children. Try to obtain eye contact or have them facing in the direction that you are. You don't want to be calling directions or instructions all the way from another room. And we want to follow that by 5 to 10 seconds of silence. So that means that we want to make sure that we have the opportunity for the child to actually hear the instruction and follow through with it instead of nagging and giving additional orders. Giving too much justification, clean up your room because grandma's coming over. And we really need to do a good job. So then in that way, the direction is lost. So trying to think about words to avoid and how to be direct, as specific as possible.
Okay. So we also want to say it in the positive. So rather than saying, don't do something, you're going to want to say what you are looking to see. So rather than like, don't touch the box, just look at the box, or stop screaming, please use a quiet voice. And that's going to be effective, and it's kind of a better way to get kids to comply. We also want to give warnings for transition. So we know that kids have, a lot of kids, and especially children on the spectrum or individuals on the spectrum, have difficulty with transitions. So we want to think about giving children warnings when especially a preferred activity is coming to an end. This can be done using, as Dr. Zweifach had talked in, I think, our webinar 1, using timers, using visual prompts. And I do encourage caregivers to reach out to the child's school therapist to find out what was effective as a transitional warning in the school and potentially incorporate that into your home schedule. Using when then statements. So if you know that your child really does not enjoy doing their math assignments, you can say, like, when you do this one worksheet, then we get to, and reinforce with a more enjoyable task. And that's another strategy to increase compliance. We're also going to want to offer choices as much as possible. For a lot of kids who might, a lot of individuals who might not understand exactly what is happening right now or why things are changing, they might feel kind of a loss of control. And giving kids, individuals, choices gives them a sense of control. So if they have 2 math worksheets they have to do, or 2 letter worksheets, saying, okay, we have to do our letter worksheets, which one do you want to start with? Or if they have to color something, which color do you want to start with? And kind of giving them those small choices will give them a sense of control. But we also want to be mindful not to give too many choices or to kind of elaborate too much. Again, as Dr. Zweifach mentioned, we want to keep our commands pretty simple and straightforward. So we don't want to give a whole rationalization. We want to just give them simple choices to give them a sense of control. So we talked first about compliance as a behavior, thinking about the things that happened before, but now we want to think about the consequences. So when we are asking for a child to listen or to comply, we want to think about the consequences, what happens after. So if a child does what we want them to do, or is listening or following a household rule, we want to offer praise, because praise is going to increase the behavior. And we want to think about labeled praise rather than just saying great job or that was awesome. We want to think about very specific praise. So if we're focusing on listening and compliance, when the child does attend or does follow a command, we want to say, like, I love that you were just listening so carefully, or I love that you put the block away when I asked you to. And again, that's going to be motivating and reinforcing. If our child is not listening, we want to potentially use active ignoring. And active ignoring helps us focus on the positive while taking away from the negative behaviors. So if you've asked your child to listen or to do something and they aren't not doing those things, we want to withdraw our attention. And as soon as the child starts to do what we asked or starts to pay attention, we want to give them labeled praise. When we do active ignoring, sometimes we do see an increase in the actual behavior that we're trying to get rid of. That is normal. We call that an extinction burst. So we do encourage families to try to stick it out and stay with the active ignoring. And this is something where if your child is working with a therapist, you can have the therapist kind of help you with this and plan for ways to kind of manage your emotions as this happens. And we also want to have concrete reinforcements for compliance. So if, again, as Dr. Zweifek was mentioning, we want to think about what is the most problematic area of our routine or our day in terms of compliance, and maybe have a very concrete reinforcement for when the child is able to comply with that routine or to comply with that task. Whether it's going outside for a few extra minutes or having extra minutes of iPad or getting to be able to pick the TV show that the family watches in the evening, making it a very tangible reinforcer will be effective. There were new slides, so I'm going to, we will upload the slides, but I could just talk about some of the things. These are all the main points, but some other things to think about are, as Dr. Zweifek said, we don't want to just say let's, or would you want to put your sink in plate in the sink. So just like we want to be thinking about our wording, we also want to think about our tone of voice. So we don't want to say something and have our inflection go up, because that's also going to imply that what we're asking them to do is a question. So we want to kind of keep a neutral, flat tone of voice when we're asking them to comply or listen. We also want to be mindful of our tone. So as parents, as now teachers and therapists, we also are under a lot of stress and might be feeling more frustrated. We also might be having to do other things outside of our child's school, or we might be short of time. So we want to be mindful not to express our frustration in our tone of voice, because as we have all probably been there, once we get frustrated and stressed and communicate that to our child's frustration and stress also kind of ramps up. And then we're kind of both feeling frazzled, and that's not going to be a productive place to get our child to comply. So kind of thinking about our tone of voice when we kind of ask our child to be listening or to be doing a specific task is going to be really important. The last thing is kind of being aware of our own emotions. So if you've now been sitting with your child and have a very simple worksheet to do and your child is not complying and you're feeling really stressed about it and you don't think you can use these strategies effectively, maybe now's the time to kind of, we like to refer to it as tapping out and seeing if there's another adult in the household that you can say, you know, I'm getting frustrated. Is there any way that you can sit with the child and ask them to take over for a few minutes? If there's not another adult in the household, it is also okay to say, you know, I'm going to be taking a 5-minute break. I'm feeling really frustrated in that I asked you to listen and you're not listening. So I'm going into my room and I'm taking some deep breaths. And when I get back, let's try again. Not only is that a good strategy for you to stay calm, but it's also really great modeling, because there's definitely going to be times in the day where the child might be feeling overwhelmed. And that is why the child's not listening. So if you can model taking a break when you're feeling overwhelmed as a way to get you to comply, that's going to show them a strategy that they can be using. If something is totally not working, the child is not listening, while we don't want to teach the child that when they don't comply, they get to a kind of avoid a topic, we're going to say that, sorry, thank you, Audrey. We are going to say that maybe, okay, you know what, mom is feeling frustrated right now. I can see that we need to change it up. So we're going to change the schedule. We're going to do this first, but then we're coming back to this. So not letting kids escape a task that they don't want to do completely due to non-compliance. But it is okay if things are really not going well, having an opportunity to reset and maybe go for a walk or break for a snack. You don't want to get dragged into an argument or a long discussion or a negotiation, because that's not going to end well. So as I mentioned, if you're finding yourself getting into these patterns, it's important to try to disengage immediately. And I mentioned too, those strategies would be the tagging out system or modeling taking a break. And lastly, I know we spent the entire webinar last week talking about this. And I want to re-emphasize this for those that were not part of our call. Taking care of yourself is so critical, because I like to think about it on the plane when they say, put your oxygen mask on before that of your child. If you're feeling stressed and anxious and frustrated, you're not going to be able to effectively communicate these demands to your child. And you're going to kind of the stress is going to spill over into that interaction. So it's really important that you're taking care of yourself during this stressful time. So I'm not going to go into it so much. We do have our webinar from last week on our website and those slides on our website, but it is important that you're taking care of your physical health. So making sure that you're eating when you're feeding your children, that you're getting enough sleep, that you're getting exercise, or at least getting some fresh air, whether it's going for a walk or looking online for a 5-minute exercise, that you're taking care of your medical health and taking any prescription medication that you're supposed to for ongoing medical conditions, that you're staying connected. So often parents, I know when they come to us for kind of social skills groups, use the social skills groups for their own kind of support groups and like connecting to other parents and other caregivers. So staying connected to your caregiver communities, finding interactions or things that make you happy throughout the day. And as Dr. Zwijfek was mentioning, finding 5 minutes to have that connection with your child is important. Finding 5 minutes in your day to do something just for yourself, whether it's taking an extra long bath, listening to your favorite song, whatever it is, those 5 minutes can make a world of difference in your own mental health. So on that note, I would like to open this up for questions. We thank you again. We know that this is a really busy time. So thank you for attending. We would love for you to write in questions into the chat feature, whether it was related to this topic or if you have a specific question related to a different topic, we're more than happy to try to answer. We would also love to hear your ideas for future webinars, because again, we want this to be, while you're taking this time away, we want this to be relevant and helpful for you.